Hello, my name is Matt Prekker, and I'm a staff physician at Hennepin Healthcare. My background is I'm a local product here. I went to medical school at the University of Minnesota. I did a public health degree also at the U of M, and then was lucky enough to come to Hennepin Healthcare for my residency. I was in the first class of emergency medicine and internal medicine combined residence for a 5-year program. And then as part of the mentorship I received here in both clinical work and research, I decided to become a pulmonologist. So I went out to the University of Washington in Seattle and did a pulmonary critical care fellowship. And as that wrapped up, we had some tough decisions to make, but I was fortunate to be able to come back and join the faculty at Hennepin. And I've been here for the past 7 years now and been actively involved in clinical research, and that's what I wanted to talk to you some about today. My job is really something I'm passionate about, I'm very happy with. I split my time evenly between the emergency department and the pulmonary and critical care division. So I do attending in the medical ICU and do some pulmonary consult work. I'm going to talk some today about clinical research and opportunities here at Hennepin Healthcare. My personal research interests are really in the acute care spectrum. I'm medical director of our ECMO program here at Hennepin, so I do research in that area. I'm also very interested in emergency airway management as we practice it in the ICU, as well as I'm primarily a clinician here at Hennepin Healthcare. I facilitate national and international clinical trials, and we're an active site enrolling our patients and giving them the opportunity to participate in this research. I think what really stand out for me about clinical research at Hennepin Healthcare are 3 things. The scope and breadth of opportunities here. I think the structure of research through the Hennepin Healthcare Research Institute is important. And finally, I think the rewards for our internal medicine residents in participating in research and being productive are great, and I'll describe those at the end. I think our interns, even by now in the year, understand how much faculty mentorship there is in academic production here at Hennepin. We encourage our interns to develop mentoring relationships very early in their first year. They can choose specific faculty or areas they are interested in, and they find, I think, very generous and welcoming faculty who want to do projects and share the excellent clinical work we do at HCMC to try to move the science forward in these areas as a safety net hospital. I think you'll find that there's a lot of mentorship and help through the regulatory process of clinical research at HCMC. This can be intimidating to physicians that haven't done a lot of research before. We have a research arm of the clinical operations at HCMC called HHRI, or the Hennepin Healthcare Research Institute. I found them to be excellent to work with and partner very closely to get my work done. The Hennepin Healthcare Research Institute operates our own Institutional Review Board, or IRB, and the internal medicine program facilitates our interns getting training in human subjects research protection early on in their first year so that they're able to access patient records and get involved in research right from the get-go. There are 4 areas of research excellence at Hennepin Healthcare, and these by no means describe all the research that's done, but I wanted to highlight them. First is research into addiction medicine and tobacco-related diseases. We have a very active addiction medicine division. The research is both inpatient and outpatient help for folks with addiction. The second focus is health services research. There are a number of different centers here at Hennepin Healthcare that welcome residents to do research with them. These include the Center for Patient and Provider Experience, led by Dr. Mark Linzer, that I'll speak to in just a moment, as well as the Berman Center for Clinical Outcomes. This is excellent research into geriatric and general internal medicine problems, including epidemiology. The Chronic Disease Research Group supports our nephrology division and others in nationally known research, and in fact, we're the site for the large data set that encompasses all outcomes of patients with chronic kidney disease on hemodialysis in the U.S. Finally, we're very proud of research focus in health of our homeless populations and those involved in the criminal justice system. We have research excellence in infectious diseases, especially with our physicians and researchers involved in the care of patients with HIV and AIDS. And finally, the focus that I'm most involved in is in acute care and trauma. We have active research partnerships with the emergency department, our medical ICU, and we have a Minnesota Poison Control Center is here at HCMC, so our toxicologists welcome interested residents to do very neat case series and case reports in that domain as well. The Department of Medicine really embraces the philosophy that no research can be done alone, and so in the department's leadership, Dr. Mark Linzer is currently the Vice Chair of Medicine and focuses on scholarship, mentorship, and education, and really ensures that our residents and junior faculty are supported in collecting their data, analyzing that data, and seeing this all the way through to publication. Many medicine residents that I mentor and research, I think, find that their work is very rewarding and productive. The benefits of doing research as a resident here in healthcare include developing expertise in that subject matter. I think that's something that can last a lifetime. Other residents embark on research wanting to understand what a career in academic medicine may look like after residency. Many of our residents are interested in doing a subspecialty training through a fellowship, and exploring that area of fellowship through clinical research is a great way to network, develop your CV, and prepare yourself best to have a successful match. As an internal medicine resident here at Hennepin Healthcare, you'll be encouraged and supported in sharing your findings with the medical community, whether locally or at a national conference. I think residents that I've mentored have found a lot of satisfaction in seeing their work through to poster or oral presentation at these meetings, networking with their peers and other faculty in their area of interest, and eventually seeing that through to publication with their name in print. Research in general, or clinical research, can be intimidating to physicians that haven't spent a lot of time doing that, but I think we've made great strides in the Department of Medicine over the last 10 or 15 years in making research in all areas of medicine very easy and supportive environment for our residents to succeed. I welcome you to meet with me when you come to Hennepin Healthcare. We can talk more about clinical research because we really have a lot to offer.